Good morning, dear students. Our first lecture is dedicated to neonatology introduction. So, neonatology is a subspecialty of pediatrics that consists of the medical care of newborn infants, especially the ill or premature newborn, up to 28 days after birth. Neonatal, pertaining to the birth of Orion. It's a hospital-based specialty, and it's usually practiced in neonatal intensive care unit. Neonatal period we will divide into two periods. First, it is neonatal early, first 7 days. Second is late neonatal period, 7 to 28 days of life. Prenatal period. This period commences at 22 completed weeks of gestation and ends 7 complete days after birth. Classification of neonates due to gestational age. By gestational age, we have preterm babies till 37 weeks, term babies 37 to 42 weeks, and first-term babies more than 42 weeks of life. So, classification by birth weight. Normal birth weight, 2.5, 3.5 kg. Low birth weight, 2.5 kg. And large for gestational age. It is till 4.2 kg babies. We have neonatal intensive care unit have some modern equipments which will help to baby neonates to survive. So it is baby crib warmer, incubator, and many types of ventilators, CPAPs, and also suction and oxygen equipments. Phototherapy lights, blue blankets, and etc. So, common causes of neonatal unit care admission. It is respiratory distress syndrome, first one, neonatal jaundice, second, neonatal sepsis, it's third reason, preterm babies, fourth reason, fifth reason, hemorrhagic disease, central nervous system disorders, meconium aspiration, pre- and post-operative causes. Procedures that we should provide in neonatal care units. Endotracheal tube, chest intubation or IV cannula, umbilical catheter, blood transfusion, phototherapy, exchange transfusion, we may provide in this department. History taking. While history taking, you should pay attention for name, gender, sibling, consanguinity, mode of delivery, gestational age of the mother, and age of baby, maternal risk factors. So what's maternal risk factors? These factors we will divide into 4 groups. Maternal age, socioeconomic factors, obstetric factors, medical conditions. So, as a being neonatologist, you should know about the mortality rates, definition and measurement of mortality rates. So, guys, live birth. Who is live birth? It is complete expulsion or extraction from its mother of a product of conception, irrespective of the duration of the pregnancy, which after such separation breathes or shows any other evidence of life, such as breathing or of the heart, pulsation of the umbilical cord, or definite movement of voluntary muscles, whether or not umbilical cord has been cut or placenta is attached. Each product of such birth is considered as a live born. Second, fatal death or stillbirth. Who is fatal death babies? Death prior to the complete expulsion or extraction from its mother of a product of conception, irrespective of the duration of pregnancy. The death is indicated by the fact of such separation the fetus doesn't breathe or show any other evidence of life, such as breathing of heart, pulsation of umbilical cord, or definite movement of the voluntary muscles. Prenatal mortality. It is an important indicator of maternal care, maternal health and nutrition, quality of obstetric and pediatric care. So prenatal mortality, we will calculate the number of deaths of fetus according to the reporting criteria plus the number of early neonatal deaths per 1,000 total births. Neonatal mortality rate, we will calculate the number of deaths in infants during the neonatal period per 1,000 live births. It is shown a formula, this slide. So, neonatal mortality, early neonatal mortality rate, the number of early neonatal deaths during given per year 1,000 live births in the same year. Post-neonatal mortality. So, the number of deaths of infants aged 28 to 342 days per 1,000 live births. Each parameter is given for 1,000 live births. Infant mortality, the number of deaths of infants ages less than 1 year per 1,000 live births. Child mortality, the most important is under 5-year mortality rate all over the world by WHO organization. All documents, it is under 5-year mortality rate is very important. A leading indicator of level of child health and overall development in countries, the fourth indicator of 8 MDGs, Millennium Development Goals. So, under 5-year mortality, how we should calculate? The number of deaths of children less than 5 years per 1,000 live births. So, this was all neonatal problems, prenatal problems that we should provide some learning, and we should teach all students for these reasons. Most reasons for neonatal deaths, it is even in developed countries, it is first diarrhea, second pneumonia, low quality of life, and etc. So another questions of lecture we will discuss in next lectures. For today, thank you for your attention.